Hey, good morning. So glad you have joined us again this week for HealthCall Live. The first part of our program today focuses on your amazing immune system and the problems that can happen when that immune system of yours goes crazy, gets out of whack, and actually starts attacking parts of your body that can result in more than 80 different diseases are linked to an immune system that is just out of control. And sadly, it happens to women far more than men. 80% of the cases of autoimmune conditions relate to women instead of men. So, ladies, this is an hour that's going to be of particular importance to you. And I want to welcome back to the HealthCall Live microphone, Gregg Russel, the pharmacist at Fort Wayne Custom RX. Welcome back.
Hi, Lee. Great to be here.
You told me that you are seeing a dramatic increase in the number of autoimmune-related conditions. Tell me more about that.
Well, we certainly see rheumatoid arthritis, for example, and allergic asthma and allergies on the increase. But we also see a huge increase in the amount of patients having diabetes, the amount of patients starting to have some thyroid disorders, and anything else. You know, the immune system is amazing. It's really our first it's our first defense. It's got to keep viruses and bacteria, and it tends to line the areas where we're most exposed, like in the skin, if you had a cut, or maybe in the sinuses, where you breathe, the food that you eat through the digestive tract. So that immune system is constantly working 24/7. But the problem is when it gets out of tilt and it gets a little too active.
So we're going to talk about diabetes as an autoimmune condition. Now, we've known for years that in type 1 diabetes, child onset, juvenile diabetes, that is an autoimmune reaction. Something in your body has triggered the autoimmune system to attack those islet cells in the pancreas, and they no longer produce insulin, so you then become insulin dependent.
Right.
Type 2 diabetes, the adult onset, is a far more serious problem in our area. Over 50% of the people in our area either are diabetic or are pre-diabetic, so it's a huge issue. And now there's thinking that it too is an autoimmune condition.
Certainly, you get back down to that cellular level. So in past, we treated type 2 diabetes as a metabolic disorder. And what that just simply means is, hey, something's going wrong. You're either consuming too many calories and your pancreas is not reacting to the insulin that it produces, or that you're not active enough, or maybe you're obese, and so again the cells are resistant to insulin. But now we look at the cellular level. There was a study that showed that actually researchers are actually looking at how the immune system plays a role, and that immune system, when it becomes dysfunctional, actually can contribute and initiate some of these so-called type 2 type patterns.
And you see a real connection between type 2 diabetes and thyroid conditions, which is another huge problem in our area.
Right. Endocrinologists have known for years that diabetes, and if you have one endocrine disorder, you tend to have a second. So, for example, if you had diabetes, they know you're at high risk for developing hypothyroidism. And what we now know is that, of course, hypothyroidism, 60 to 80% of patients tend to have an autoimmune thyroiditis. So basically, that just means that the antibodies are attacking. Antibodies to the thyroid are attacking the thyroid and actually destroying part of the cells that produce thyroid hormone.
Well, I neglected to mention as part of the intro that Gregg is not only a pharmacist, he is also a clinical nutritionist. And so we're going to approach this from that standpoint as well today. So let's talk about diabetes in a more focused thought pattern along the autoimmune line. So help me understand, what can you do for me beyond traditional medications that a physician might prescribe to help me manage my diabetes?
Sure. I think we have to first of all understand that diabetes you have to look at as a holistic. It's not just affecting the pancreas. And so we're not advocating that people get off their diabetes medication at all. We'll never advocate that. But we do want patients to understand that there's an inflammatory and autoimmune component to it, and that for example, we need to pay attention to how we can adjunctively improve their disease management. So, for example, we would advocate that patients really look at what they're eating. What food choices can we do? Can we do an anti-inflammatory diet, for example, or an autoimmune diet? And there are definitely ways to eat that will improve that.
Oh, let's talk about that. What is an autoimmune diet?
Well, I think what you're trying to do is, you're trying to find those foods that tend to trigger inflammation. So they tend to be the foods, unfortunately, that we love the most and that we eat the most.
Yeah.
Okay. So I would say that one of the biggest problems we have in our food supply today is we do tend to eat a lot of processed foods. Do you know what I mean when I say processed foods?
No. What? So
okay.
what? Yeah, that can mean anything.
That could be convenience foods. So, for example, when you're at the grocery store, and you've heard it from other people, not just myself, that if you shop the edges, what we used to call the perimeter, and I know now a lot of grocery stores have redesigned their. But if you're looking at the fresh fruits, the fresh foods, the good organic meats, those are things. Try to eat a little less red meat, a little more of the fish and the chicken, and try to really pay attention to what we're eating and get away from those those sweet things that we love to eat, those refined sugars, and those really salty foods.
Yeah, well, we can talk more about free sugar another time,
yeah.
and added sugar that come in so many products. But if it comes out of a box, your concept is it's probably not the best choice.
It's not the best choice, no.
So, in dealing, you told me that you are just astounded that diabetics don't get more education as part of our healthcare system, just fails people.
I think it's kind of like when you went to school, you didn't get English one time and then forget it for the next 12 years. You took an English class all the way up through elementary and through parts of high school, right? So that you continue to learn about English or mathematics or whatever might be the class. And I think, unfortunately, patients sometimes get a real quick little education on diabetes, and out the door they go, and they just don't. If you're not continually learning about it, you're going to forget it.
So in your practice, in the patients that you work with, you go beyond fulfilling the prescription, if they're interested, of course, and then do what with them?
Okay. Well, one of the things that we tend to do is, I'm amazed at how many patients get put on medications, and they have so many questions, but they forget to either ask the doctor, or they don't think the doctor has time to address those. And there may be some truth with it in today's healthcare system. I don't think it's not that the doctors don't care. I think they are just squeezed for time. But I think what we do is we try to sit down one-on-one with people and actually look through their medications, make sure they understand how to take those medications appropriately, talk to them about if they're having any adverse effects. If they are, how do we get the most out of those medications and try to prevent those? What does the patient need to get back to the doctor about? So, for example, if you have diabetes, do you know what your A1C is? Are you monitoring your blood sugars? If you're not, how can you give that information? How do we know your therapy's working if you're not able to give that information back to your doctor?
And in terms of supplements and additive products, is there anything that's proven to be effective and is truly helpful in this process?
Well, when it comes to supplements, they're always a gray area. However, we know, for example, when we look at thyroid disorders and we look at autoimmune, there's a paper that talks about selenium deficiency. Now, here we are, we're in the Midwest. And we know in the Midwest, we had a lot of glacier activity. So wherever the glaciers were, the selenium is no longer. So because they brought in lots of good topsoil, which is why we're such a good agri state. But unfortunately, our soil tends to be deficient in selenium. That might be more important if that's the only food we ate. We do get food from across the world that comes out. But what they did do was in the study, they were able to show that they could take down thyroid antibodies by supplementing selenium. And basically, they supplemented between 100 and 200 micrograms. And depending on where you fell with your selenium levels, they might load you with 200 micrograms of selenium and then back you down to 100 micrograms. But anyway, regardless, if somebody was on 200 micrograms of selenium, their thyroid antibodies did decrease. So there's evidence that basically food, unfortunately, our food is depleted in some of these minerals, but that certainly certain supplements like selenium can help. And then we have other supplements, for example, like vitamin A and certain herbs that help with stress that also will reduce some of those inflammatory effects that suppress our thyroid.
Stress is such an important role in everything related to what we're talking about here.
It sure is. So, stress for an American is 24/7, right? We got a lot of things to do. We work, we raise families, we're worried about things, we're constantly under stress. And unfortunately, chronic stress has been linked to increase in autoimmune. So there's an interesting study on post-traumatic stress disorder that talks about this acute chronic stress actually being a relational to an increase in all these chronic autoimmune disorders. So, for example, you talked about 80 autoimmune disorders. They basically broke it down to 8 different classes, and they found that every patient that had PTSD, when they matched them to people who didn't, had a much higher rate in autoimmune disorders. So then there's theories. Well, why is that the case? Well, part of it, the thought is that cortisol itself drives, normally if I get exposed to poison ivy, for example, I take a prednisone dose pack, right, for like 5-7 days, and that suppresses enough of your body. It takes the inflammation down and it suppresses the reaction that's occurring. But we know now that if we do, the doctor doesn't leave you on that for weeks and weeks on end, because on the long term, it's actually detrimental to your health. And that's the problem with cortisol. Think of cortisol as, hey, I'm actually taking prednisone every single day. Well, when we see that, we actually see the prednisone breaks things down and it makes things misfunction. Or, I'm sorry, I said prednisone, I meant cortisol.
Cortisol.
Yeah.
So you're saying that all the stress that we're exposed to, our body's reaction to that is the release of cortisol in our system. And so we have this constant exposure to cortisol, which makes us more apt to suffer other conditions.
Right. And over a period of time, the body does adapt to that. It says, you know what? It's not healthy for you to have your own increase in cortisol all the time, so we're going to suppress that. And that's when you're in danger. When the cortisol gets really suppressed throughout the day so that it doesn't react, that's when you're going to start seeing the fatigue. That's when you start getting sick. That's when like a herpes outbreak might reemerge. Everybody knows that I'm stressed. Then I get the flu. Then 3 months later, my irritable bowel picks up or whatever. And so there's definitely links to all those things.
And so what can we do about stress other than, meditation and mindfulness and all that kind of stuff?
Yeah, those are really huge and very important. Again, stress takes many different forms. So if we're talking about physical stress, for example, I ate the wrong foods, I stressed my body. Okay, I had to rev up the immune system because I ate bad foods that my body wasn't designed to eat. It might be, again, as you said, the relaxation component. There's a really kind of cool software program called HeartMath that you can download from the Apple Store, for example, and put it on your iPhone. And it teaches you this whole thing about how to breathe and how to it's not a meditation per se, but they used it in like the Olympic team to teach the biathlons where they ski forever and then they go out and they shoot and they have to get their heart rate down. Yeah. That's the exact same software the Olympic team used. So that whole idea is to get your parasympathetic system back more dominant than your sympathetic. So in other words, we're constantly under fight and flight, but we need to relax, and breathing and doing some of these techniques will help improve that.
All right, what's on the shelves that I can take if I'm not the kind of guy who's going to sit down and do some breathing exercises?
Sure.
Is there something that's legitimately going to help me reduce my stress level?
Absolutely. So we talked about the thyroid and the diabetes earlier. Well, the third leg of what I call my three-legged stool is your cortisol response. And so you have to keep your cortisol response really good. So we talked about, we've talked in the past that cortisol is highest in the morning and then it goes lower in the afternoon. So depending on your pattern of what your cortisol is looking like depends on how we might treat that. So somebody who has really high cortisol, we need to get that cortisol down in the morning, for example. So we might use a certain adaptogen that might bring it down. So one of my favorite adaptogens that I like to use is ashwagandha. Now,
ashwagandha.
Doesn't it sound like a foreign country or a foreign planet? Yeah, it's just a crazy sounding thing. But it's very good whether your cortisol is high or your cortisol is low. it helps put you back into your pattern of getting your cortisol back into the proper rhythm. We want your cortisol higher in the morning. We want it lower in the afternoon. We want it to be very low at night. Why is that? Because your metabolism is slowing down. We want you to go to sleep. We don't want your cortisol revved up and increasing your metabolism. As you sleep overnight, your cortisol starts to go up. And the reason why it's going up, it's starting to suppress the inflammation in your body. It's helping you heal. But we want it at a certain level in the morning when you get up. We don't want it too high. We don't want it too low. That is called a cortisol rhythm. And do you know what determines your cortisol, when your cortisol goes up and down?
I have no idea.
Sunlight.
Oh, okay.
So that's why we're made to get up in the mornings when the sun's out and sleep at night.
Might have a connection as to why those third shift workers have such weird health problems.
That's exactly right.
So, and there's another supplement that I can take that you believe in for stress reduction?
Yeah, rhodiola is the other one that I like. Again, there's some really good evidence. Rhodiola is one of the most studied herbs out there, and the USSR, when back in the Olympic days, did tons and tons of research on rhodiola as being a stress or an endurance herb. And it does show that it seems to help with stress reduction, not so much on the endurance, but definitely with stress reduction.
All right, so we've got just a couple minutes left here to talk about thyroid, which is just a huge problem all the way around. And you told me that when somebody comes to you for either thyroid, you start looking at them for diabetes, or vice versa. If somebody comes in and wants to talk about thyroid or diabetes, you're always looking at thyroid. What's the connection between these? Well,
for example, if when you have diabetes, then your inflammation is going to go up. And when you have inflammation that's going up, you get insulin resistant, insulin goes up, then it blocks the conversion of T4 to T3. And T4 is a long-acting thyroid hormone that your body makes in the thyroid, and then T3 is also made in the thyroid gland. It's released more intermittently, and it's converted from T4 to T3. So we know, for example, diabetes increases the risk of slowing that conversion of T4 to T3. Well, the important why we want T3 is it's about 3.5 to 4 times stronger than T4. And you can have all the T4 in the world, your TSH could look perfect, but if you don't have T3 working at the cellular level, which is where it works, then you're going to have a kind of a functional hypothyroidism. In other words, your numbers look pretty good, your TSH looks good, but you don't feel good. You feel like you're low thyroid.
Yeah, okay. So as working with you as a nutritionist and as a pharmacist is a little bit different than I think most people are accustomed to, that guy behind the window at the big chain store.
Yeah.
So you offer consultations. Tell me more about how I get involved at that, and what are you going to do? What are you going to teach me?
Yeah. So for us, the primary reason we do a consultation is, from my perspective, I'm kind of unique in that I look at both medications and nutrition. So I'm going to look at your medications like we talked about earlier, making sure those are optimal for you. The second thing I'm going to do is I'm going to talk about adjunctive therapies that will help you control your disease better. We're not becoming your physician. We want to work with your physician. What we try to do is give you good, clinical, proven, effective therapies that's going to help optimize your therapy. And then the whole idea is we believe in preventative medicine, right? So if you can keep your stress levels down, that's going to lower your chance for developing an autoimmune disorder later on in life. So you're never too young to learn about how to manage your health. Maybe you have absolutely no health issues right now. It doesn't mean you can't come in and learn something from us.
And the first step to doing that is to call Fort Wayne Custom RX and ask for Paula, and then she will brief you on the process and what you need to know, information you need to prepare, and schedule a consultation with Gregg Russel, the pharmacist and clinical nutritionist at Fort Wayne Custom RX. You can find them online at fwcustomrx.com, and they're at 425 DuPont Road. That's right behind the Casa Grill on Fort Wayne's north side. And Gregg, thank you for joining us.